The following webinar was recorded as part of the original implementation of IWISH and has been made available for informational purposes only. Some portions of the original recording have been cut to ensure participants' privacy. References to the Lewin Group, implementation team, site liaisons, PHL, Google Drive, and some forms are not applicable to the demonstration extension effective October 1st, 2020. Terms and conditions of grantee's cooperative agreement supersede any information presented here. Please see the IWISH Operations Manual for the most up-to-date implementation information.
Go ahead and get started. Hello everyone, Happy New Year. It's IWISH Health and Wellness Assessment. We introduced it to you all during the in-person training. We were able to give you, you were able to view a copy of it, so we're going to talk some more about it today. We're going to also understand the why and how of requested domains. We'll then also discuss other general information relevant to the assessment. And then of course, we'll answer any outstanding questions that you may have. One thing to let you all know, as the case may be, I know we have a couple wellness nurses that have been hired since our in-person training, and we may also have some people that attended the in-person training but don't quite remember what we covered. Not a problem. On our Google Drive site that many of you all are aware of, the assessment session is posted there. So when we send out the link and the recording and the slides from today's presentation, you'll be able to click the here button and be able to be taken straight to the Google site where you can review the assessment session from the in-person training event. And last thing before I hand it over to Lisa and Alicia, just to remind you that we cannot conduct the assessment until we receive O&B approval. So I know a lot of you all are ready and eager to get IWISH started because you've talked to your residents and your residents are asking questions and they're eager. And we love that. Keep the excitement, keep the momentum, but please be reminded that you cannot conduct the assessment until you receive the notice from us saying that we have O&B approval and that we're prepared to move forward. So now I'm going to hand it over to Lisa to start us off talking about the IWISH Health and Wellness Assessment. Lisa?
Thanks, Joy. Go to the next slide. So we talked about the assessment a bit during the in-person meeting, but we wanted to make sure that you all were well-grounded in it as we get closer to actually using it. So again, back to an overview of the assessment. It provides a comprehensive understanding of the participant's status and their potential needs. We talked about during the last office hour as it being kind of a fresh look at the resident, even though you may already have a long working relationship with them and lots of information on them, and it gives us a chance to kind of get a baseline for the purposes of the demonstration. It'll take hour and 15 to an hour and a half to complete, and it includes 13 validated tools, which includes scoring, and for I think nearly all of them, the PHL platform will generate the score for you. So that's almost a third of all the questions that are from validated instruments, and it covers in total 9 domains. And the reason for doing this assessment is to help you, both the resident wellness directors and the wellness nurses, be effective in your job, because it will inform the individual healthy aging plans, it will inform the overall community healthy aging plan development, what programming you need, etc. So it's a very key component at the start of the interactions with the residents and participants. We go to the next slide. This gives you a sense of kind of the total number of questions, and yes, the number is big, but a lot of it is name, address, telephone number, other contact information when we get to some of the contact stuff and the organizations that are currently supporting the participants. But it also shows you on the right-hand side where the validated questions come into play and the importance that they'll play on the on the health status and particularly the cognitive and behavioral health status and functional status questions. Go to the next slide. So this is the list of the validated tools. There's a physical self-maintenance scale that looks at ADLs and IDLs, which a lot of you may already be familiar with. There's a nutrition assessment that the acronym is DETERMINE, and it looks at food insecurity and other issues. There's a falls risk assessment supported by the CDC called STEADY. There's a mini-cog, which is one that actually is the one you're going to need paper for because they have to draw a clock. We have a loneliness scale to get at some of the social connectedness and isolation issues. There's a Mariski medication adherence scale, which has 8 questions that gets at whether they're taking their medications the way they should, and some other kind of adherence questions. There's a GAD-2 and GAD-7 screens, which get at some of the I'm blanking on which one that is. Alicia, can you help me out?
Yep, that one is looking at their whether the residents are experiencing anxiety or not.
That's right. Okay, thank you. And then there's PQH2 and 9, which is a patient health questionnaire, and that one is more of a mental health and well-being type of focus. And then finally, we have
and Lisa, that one is also looking at depression.
Depression, right?
Right.
So that's all the particularly validated tools. And on the next slide, we're hoping you might be able to let us know how many of you have used one of those. And so we have a poll. And actually, if we go back to the prior screen, it might help people remind themselves of the ones we just talked about, and let us know whether or not you've actually used one of these validated tools, any of them. So your response possibilities are yes, I have, no, I have not, or I'm not sure. So Nora, do we think we've given them enough time?
Yes, I think that it's showing up right now, and I believe I can share the polls now, the results. Can you see them, Lisa?
I can. So among the people who answered, actually quite a few have used at least one of these. We have 84 people in attendance, 41 of which did not answer this question, but 36 answered, somebody's saying the poll didn't work for them, I'm sorry. 36 said that yes, they have, and 6 have said no, they have not, and 1 wasn't sure. So for those who were able to answer, looks like a lot of you have used at least one of these, and I'm betting for many of you that might be the ADL and IADL ones. Mini-cog, somebody said, yeah, anybody put in chat which one you might have used or multiple ones you might have used. Brenda used a lot of them. Got a nutrition assessment, PHQ-9, fall risk. Great. Falls risk. Great. So a lot of these won't be, for a lot of you, they won't be new territory. So for some of these, I know we kind of covered this a little bit during the in-person meeting, but the other thing we wanted to get your input on and have you share information about are strategies that you've used that worked for you when asking participants about potentially sensitive information. We've got lots more coming in terms of ones they've used, so that is absolutely fantastic. So on the strategies, privacy, confidence, and positive interaction, let them know that you're going to ask personal questions in advance. Yeah, give them fair warning, and that the information is important for you to be able to help them. Someone else uses the giving them fair warning approach, that there will be personal questions and that it will be kept confidential. Yep. That seems to be the most common strategy. Brenda says you need to be comfortable with the questions so that you don't project that you're uncomfortable when you're doing it, which that's a very good point. Patient and kind of let them answer at their own pace. You can always go back and revisit, yes. Inform them of my role, that the information is to help me to assist in whatever support and assistance they may need. Make it a conversation versus an interview. Yeah, I think that goes back to Brenda's point about being very comfortable with the questions and kind of the flow. So we're hoping, well, we'll be able to take time to practice in advance of actually engaging the residents and participants. Develop rapport. Allow the conversation to occur in a private place that's comfortable to the resident, a place that makes the resident feel empowered. Inform them of the type of questions you'll be asking and let them know if they're not comfortable with the question, you can move on or skip and come back later. Yep. Ask the person to tell you a story about the question. That's an interesting one. Personal conversations in a private setting in a comfortable space. Okay, let's move on to the domains. Alicia?
Thanks, Lisa. And Happy New Year to you all. I wasn't able to be on the webinar last week, so this is my first chance to reconnect with you all this year. I hope everybody had happy holidays. So if we could go to the next slide, please. So I'm going to go through just kind of an overview of the domains, the kind of main subject areas of the assessment and the types of questions that are under those areas. And hopefully all of you all got the draft copy of the assessment that you might be able to follow along with or reference later after we go through this. So the first part of the assessment is just a kind of general participant information. Should be pretty simple to gather. It's looking at those demographic pieces about the resident. It's also gathering participant contact information, which is going to let you know who the resident has in their support network, whether family or other caregivers, and whether those contacts have any special support roles for the resident in terms of maybe having a POA, power of attorney, or anything like that. It's also going to let you know who their emergency contacts are, so when you need to get in touch with someone, you can do that. And that's obviously not going to be too new to any of you all. It's also going to ask you about their insurance, and this is going to be important to you all just to know what kinds of insurance they have, and that will give you an idea of the potential benefits that they will have access to. So, for example, if they're Medicaid eligible, they might have access to medical transportation or home and community-based services. It might also show you if they're in a Medicare Advantage plan, they might have special benefits in that plan. And it might also show you that if you have a concentration of residents with a particular Medicare Advantage program, there might be an opportunity for some collaboration or partnership with that plan around their members. Also in the section is something called the General Information section, which gathers a little bit of different information about their well, I'm sorry, excuse me, okay, I'm sorry, I'm getting a little bit confused. We're not going in the order of the assessment, so I'm sorry about that. So this is just going to give you some different information about whether the participant has an advance directive or do not resuscitate or their powers of attorneys, whether they have use assisted devices, and what kind of transportation access they have, whether they drive their own car or use public resources or have other supports available in that area. And then there's going to be a section where it's going to ask you about the supports that are available to participants. And my apologies, I was going out of order there. So that's where you'll cover that insurance information and that contact information. And then you're also going to find out about the kinds of services and resources that they are currently using. So you'll sort of know a starting point of where they already are in terms of supports that they have in place. And then you're also going to gather information about their clinician information. And this information is really going to primarily be focusing on their primary care physician, if they have one, and then you will identify if they don't have one, and you may need to help them access it. And then those key specialists that they use. So you won't really need to track every single doctor or physician they see, but, for example, if a person has congestive heart failure and they regularly see their cardiologist, you'd want to track that information. The next area in the assessment looks at sort of general health status areas, and that's where you're going to collect information on immunizations that they have had, and you may find gaps that they need to get filled, any allergies they may have, and then you're also going to collect a range of vital signs, including their blood pressure, if they have diabetes, some information on that, and so on. And then there is a general health assessment. Let me get to that real quick in my stack of papers, talk about that. So this is where you're going to look at some of their health practices and needs. So do they do an annual exam? When is the last time they had an annual exam? Do they use assistive devices? Do they, what are kind of their foot care practices? And what kind of surgeries have they had? So this is going to give you kind of a little bit of mixed information about their health needs and practices. And then also in this subject area, you're going to find out about people's specific diagnoses. And there's a long list in there that you'll see. You're not necessarily going through every item in that list with them, but you're having a more general discussion with them to diagnose their, to fill in their current diagnoses. Can we go to the next slide, please? And then there's a section on medications, and this includes a couple different parts. So first, you're going to be collecting a very concrete and thorough list on their medications about what they currently have, you know, what medication they're taking, what the dosage is, what the frequency is, how they take it, anything special about it. And then you're going to be trying to get at questions that are going to help you gauge their adherence to taking their medications properly. And there's a couple different ways to do that in the assessment. There's some questions that you would ask the resident about each of the medications, and then there's a general overview that's going to give you their general adherence, and that's through the Moritsky 8-item medication adherence questionnaire. And then there's a section of questions on the cognitive and behavioral health status of the residents, and that includes several of the screens that Lisa mentioned earlier, the evidence-based screens, the mini-cog, which is going to measure cognitive health or assess the potential concerns around cognitive health, the UCLA loneliness scale, which is going to gauge people's social connectedness and isolation, and then there's a behavioral health section that is going to ask a couple questions about drug use and alcohol use, and there's a potential that those questions, if they identified any concerns, would trigger the use of more comprehensive scales in the MASG and the DAS-10. And then there's also questions to look at whether people's tobacco use. And next, there's questions that look at the two questions that look at anxiety and depression. And again, the same thing. They're screener questions, and if the screener questions identify a potential greater concern for that the resident is experiencing anxiety or depression, then you'll do a more full screen that might gather whether there's additional resources or assistance you might need to provide around anxiety or depression. And then finally, there's a category looking at functional health status. And so under this, again, are some more validated screens which look at the activities of daily living and the instrumental activities of daily living, which I think many of you are definitely familiar with. And then a nutrition assessment to find out whether people have different nutritional risks that could be around access to food or potential health issues that are interfering with their eating or getting good nutrition or absorbing good nutrition. And then finally, there's a falls risk assessment. And you'll notice on both of these slides, there's been some recommendations that follows that you'll also saw in the operational guide that suggest what portions the wellness nurse should do of the assessment. Those are generally the questions that are more physical and functional health oriented. However, we know there are some wellness nurse directors at the sites that are well versed in doing these types of assessments and have done this in previous positions. So it is up to each IWISH site to work together and determine how you all want to split up the assessment.
Yep, so we're going to show it up on the screen also. So I think somebody's asked, with the information to be obtained, my concern would be duplicating the information from paper to computer if the client doesn't have Wi-Fi in their apartment. Yeah, so ideally you will be doing this into a tablet or a laptop.
So some of you may have been on our most recent office hours, and there was questions about Wi-Fi connectivity. And I'm going to be putting together some guidance that we're going to be emailing out. But basically, every site in the demonstration should have either gotten as a budget line item, often in other direct costs, a budget for either putting in Wi-Fi or for having a data plan or package associated with the laptop or tablet. And so we'll be sending out an email, but it's going to be sort of encouraging you to get with the folks that negotiated the budget and just make sure that everybody's on the same page, because we did try to account for having either Wi-Fi or a data plan. So hopefully, and it is our intention, that there won't be a lot of duplication of effort where you're having to go into every resident's apartment, do it in paper, and then go back to the office. We're trying to avoid that. So we will be in touch with that soon. But the good news is it shouldn't be an issue, and it is something that we foresaw during the budget process.
Thanks, Leah. Someone also asked if the assessment could be completed over time. And yes, if the person you're working with tires or is kind of hits a wall in terms of the time you're spending with them and the types of questions, you can do that over multiple sessions as needed, but I wouldn't spread them out too far so that you could get it completed and get a valid baseline. Any specific questions related to the mental health and behavioral health? Most of them are pretty straightforward. The social connectedness has questions and then a scale in terms of the how often. Similar with the behavioral health related to alcohol and drugs and tobacco. The anxiety screen also are scales related to how often. Also the PHQ-2 and the PHQ-9. So most of them are statements or questions, and then just finding out amongst the responses how often those are an issue for the resident. We are preparing a scoring guide. In PHL, these will get scored and the score will pop out. But so you have a full understanding of the the validated tools and the scoring process. We're going to be providing that scoring guide for you. So I'm not seeing any questions related to these, although everybody wanted to talk about these. So I don't know if we unmute folks and give them a chance to share in that way, or oh, we got one. If someone answers they had, maybe not. So if someone answers they had 4 or more drinks 3 or more times in the last year, do you fill out both assessments? So this is on the mask and the staff. So the 2 or 3 of the 4 of the following. I'm not sure which both assessments you're referring to. So the one about drinking is the SMAS.
Hi, Lisa, this is Alicia. I'm not sure if I'm answering Tayshawn's question right or not, but so if they had the 4 or more drinks 3 or more times in the year, that would trigger you to do the SMAS-G. That's the only one you would do in response to that question. If they then answered something, answered the question that followed that about illegal drugs, you would then, in a way that triggered the follow-up, you would then do the full DAS-10.
Okay, I think you answered the question. Yeah, so one is focused on alcohol and one is focused on drugs or illegal substances.
Hi, this is Nora here running the WebEx, and if you guys felt more comfortable with asking a question on the phone line, I think Lisa and Joy mentioned this at the beginning, but if you raise your hand, I'm going to be able to unmute you.
The resident says that he, she does not drink. We don't have to do the cognitive, right? Well, you don't have to do the SMAST, correct. Marijuana is legal in Massachusetts. How should we handle the DAS-10? So that's a good question, and it actually came up, I think, as part of the in-person written down questions. We are working on an answer to that. I don't know if you want to add anything, Leah.
Yeah, so that is a really good question, and it's something that we are working on. I know that might not be satisfactory, and the reason is because, as you know, or may not know, that it is, marijuana use is still federally illegal, and because these are federally assisted housing sites, there are certain rules that might come in conflict with what's going on in the state. So we want to make sure that we're giving information that is clear and accurate, so just give us a little bit of time to figure that one out, but we will be getting in touch with folks.
For those of you who are were service coordinators prior to taking on this new role, if you found out something about that, what's your property's policy, or what's the way that gets handled now if you find out somebody's doing something that is in potential violation of their lease? You can either raise your hand to tell us verbally or type it into chat. So we've got two folks saying that it's not legal in the building. One who's in Michigan, where medical marijuana is legal, but they can't be in possession of it in the building. Somebody says they report to the property manager and reach out to the resident to offer resources. The resident service coordinator, they notify property manager, and resident will receive a lease violation in Chicago. Got buildings that are smoke-free. Tell residents they have to go off the property to smoke. One, Natasha says they do a confidentiality form that if they have a lease violation or break the laws, we have to tell management. And Judith says even though it's legal in Massachusetts, it's not permitted in their building. And Patty says all their residents are aware that we must adhere to federal laws and that marijuana is not allowed in any form in our buildings. It includes medical marijuana as alternative forms of marijuana. Michelle says potential lease violations are discussed with the residents and reported to the management staff. We then work with both to resolve issues. That's helpful to get kind of what the current practice is within the properties. Okay, so if we don't have any more on the cognitive and behavioral health, do we want to move on to functional health status and see if there were any questions for there? Got one more on the marijuana, that management sent out memos to all the residents informing them that the use of marijuana is not permitted in the building due to federal funding. Yeah, because that's something new for all the California sites now, too.
Lisa, this is Leah from HUD. I just wanted to thank everybody for sharing that. That was really extraordinarily helpful. And in case my comments earlier were indelicate, our intention is not to roll out something that is going to step on or take away your current housing policies. So I just want to make sure that that's clear, that we're not going to be rolling out something that is like coming down and is a conflict from what you guys are already doing. And it's really helpful to hear how folks have handled this this situation. So thank you.
Any other areas of the assessment folks want to focus on? I think the number 2 option was functional health status. That one includes some pretty standard activities of daily living and instrumental activities of daily living questions. With the scale of being independent or needs assistance. So it's not, it's pretty the binary scale as opposed to a continuum.
Okay, can we go to the next slide, please, Nora? Okay, so we just want to end up with telling you a few and just discussing a few bits of other relevant information about the assessment with you. So HUD will be providing translated assessments after the assessment has been approved by OMB. They don't want to invest in translating those if there's going to be changes that have to be made. So that's the reason for holding off on that. But that doesn't mean you can't start thinking about the translations that you're going to need to do once you are able to start rolling out the assessment. So you should be making a plan between your resident wellness director and your wellness nurse about how you're going to handle these and what other resources you're going to need to bring in besides yourself. Even if you do have the translated assessments, how you're going to roll those out with residents, whether you all have the ability to do those languages or you still need some help, or if there are some more minor languages that we might not be able to trust to translate the assessment in to, and how you're going to handle those assessments, as well as other pieces like the person-centered interview. So you can start thinking about to start preparing for those, excuse me, I'm sorry, I'm reading the slide wrong. So that, as I said, you'll also, in addition to thinking about just the translation needs for the assessment, you're going to be thinking about those for doing that initial consent with residents where you sign them up and enroll them in the program, and then completing the person-centered interview as well. So you will want to take notes during the assessment. You will need to have paper on hand for a specific piece of the assessment, which is the mini-cog. Residents do need to draw some diagrams as part of that. But you'll also want to have paper on hand for your own notes. So as you can see from the draft paper assessment that you have, there's not a lot of space for writing more extensive notes in there, although you can certainly do that. But you may also want to have other paper on hand that you can write notes to yourself. And some of those notes may be like as you're going along and ideas are being triggered for you, or about what a resident might need or how you might be able to help them, or suggestions you might be able to make to them in your future interactions. You can keep track of that, or things that they say and mention that might give you hints as to how they like to be worked with, don't like to be worked with, what kind of things they're going to reveal to you or not. You might want to keep track of that and keep notes that this was all going to help you for your future interactions with the residents, and in particular for your future work with them to develop that individual healthy aging plan. So you'll start to see things come out of here that are needs or interests that the resident has in addressing. There is a space in the online platform in PHL for you to be able to take notes as well, and you will learn about that. We will show you how to access that and where to do it. But you may still want to keep your own handwritten notes. So the next slide, please. So these are just a few last overview points about the assessment. You should do the assessment in wherever the participant chooses. We hope ideally that's their apartment, which gives you the opportunity to observe their living environment informally while you're talking with them. It also is the best place for being able to review their medications. They're all right there. You can kind of see how they keep them, where they keep them. So you can get a sense of what kind of management process they have for their meds, and hopefully see them all rather than what they choose to bring down to you if you do it in an office. However, you can also, if residents don't want to invite you into their apartment, you can do this in an office or another common space. It just needs to be a private place where you can maintain the residents' confidentiality as you discuss these issues. As was mentioned earlier, you can do the assessment in multiple visits. It doesn't have to be done in all one time. You can see there are a lot of questions, so there may be some residents that may tire in trying to complete the whole thing, or you just may not be able to get through it all with them and within a designated time that you have. So you can do this in multiple steps. As Lisa said, we would recommend that you try not to drag it out over too much time of a time frame. You can skip around in the assessment as you want. It's laid out in what we think is a somewhat logical pattern in the paper version, but you can, in the process of your conversation with the residents, they may start answering questions in another section. So you can skip to that and then come back. Or as somebody mentioned earlier, if you're asking some more sensitive questions that someone is not yet ready to answer, you might skip that and come back to that later in the interview if that helps them feel more comfortable after talking with you for a little while. When you do enter the responses that you get from residents into the online database, into PHL, you can go back and modify those responses, whether maybe you realize that you entered something incorrectly, or you want to augment it, or if you are doing the assessment over different time frames, you can come back and fill in the information that you get at a later date. And anything that you collect on the paper assessment or in your own personal notes does need to be stored in a locked file cabinet, since that will contain personal information that we need to protect and keep confidential. And the next slide, please. So as we discussed in some of our previous trainings, ask after the assessment is complete, since both the resident wellness director and the wellness nurse will be doing different portions of it, you'll want to get together with your team and discuss the what you heard from both the health and wellness assessment, which we just discussed, and the person-centered interview, and start preparing for your next conversation with the resident to develop their healthy aging plan. So, one last time for anybody to ask any questions they may have.
Alicia, there were a few that came in while you were talking.
Oh, okay.
If members do not want to answer a lot of these question sections, are they still able to access other services? And none of these questions are required. We encourage you to, try to get people to answer the questions to the extent possible, but none of them are required or to, well, actually, that's not completely true. Some of them are required because they're required in the tool, but those have more to do with name and address type of things, I believe. There's also a question about the O2 stats and requiring a doctor's order, and I believe this might be a situation where that's a requirement by the wellness nurse's employer, and we will provide guidance on that one also. I think we're likely to have people, do whatever their organization policies are on that, but if it's different from the norm or, the expectation, we'd like to hear about that so that we can keep track of that and understand what's going on and see maybe if we need to be speaking with the contract agency for the wellness nurse to explore a little bit more about whether some of these things might be possible if it's against current policy. Question about what we recommend for word choices for languages that do not have words that exist for terms like RWD and wellness nurse. I think we're going to have to take that one back and think about that. I think it's a particular issue for Russian that Mindy's raising. Question about whether to keep a copy paper version in the file in the office. I think that's up, if you've transferred it from paper to PHL, if you shred it and get rid of it, you don't need to keep the paper version, but if you want to keep the paper version, that should be in a locked place. Aside from assessments, where are we going to maintain our case notes? We'll address that with the PHL platform training. There are several places to do that.
Pick up the cards. It was an error on the cards, and so the representative told me to just read.
So we've got, someone noted that people can do O2 stat monitors at Rite Aid over the counter that anybody can use, but I didn't, again, this was a particular employer's policy. Start date for the assessments, I know you guys keep asking, but still pending. And when the IWISH demonstration starts up and residents are signing on, when will their annual assessments be completed on sign-up date or date of birth to spread them out throughout the year? Oh, that's a good question. Right now we have it annually, but
horrible because
we'll take that one back and think about that one, I think.